The following video deals with the billing of the patient. All billing is processed within a single screen. Enter the patient number by free text or by scanning. Select the patient episode that is relevant to the billing. This will populate the screen with all episode information. The location will default to the last location occupied by the patient, including the bed. The transaction date will default to real time and can be selected from the calendar. Stock items can be billed in one of three methods. Add stock item will bring up the stock billing screen. Entry by stock code will require a stock code to be entered if it is known, and tab will populate the screen with the information. The quantity can be entered, and save and new will allow for the billing of another item. Stock code items can also be billed by entering a description or a partial description. This will bring up the stock search screen of items similar in description. Adding an additional description will narrow down the field of search. Selection of the item will populate the billing screen, and the quantity can be altered. Save and new will allow for an additional item to be billed. Formline billing is a rapid form of billing whereby the charge sheets are set up for various hospital locations. Entry of the formline number is all that is required to bill the item. Changing the quantity and save and new. If the item has an average cost that is higher than the current retail price, this will be reflected as a warning message. The last stock item saved will display at the bottom of the screen. Billing by scanner will bring up the stock item scanning screen. This is a very rapid form of billing used predominantly in theatre. Once the billing is complete, close the screen. All items will be displayed at the bottom of the screen, and these items that have been billed can now be edited or deleted if billed in error. Tariff billing. Tariffs are items that are neither stock nor accommodation charges. That is, charges such as theatre time, equipment, and procedures. These occur as base rate tariffs, such as for a procedure, or per unit tariffs, such as theatre time and gases. In order to charge theatre, select the correct location and the date that the procedure took place. Select the Tariff tab and add tariff item. In order to do base rate billing, such as for a procedure, enter the tariff code or a partial description. A description will bring up the tariff search screen. Select the relevant tariff, such as bladder catheterization, and save and new will allow for an additional billing item. Per unit billing, such as theatre time, will require the code to be entered, and this will display a different tariff screen. The date in and date out of theatre is important to be captured correctly and will default to that on the main screen selection. Time in and time out of theatre should be entered. Tab will display the relevant amount. Procedure codes, anaesthetists, and doctors can also be entered, as well as modifiers. Save and close will display the items that have been billed on the main screen, which can be edited or deleted accordingly. Accommodation billing. In order to bill accommodation, select the Accommodation tab and add accommodation item. A billing line will display for each bed transfer or location transfer made by the patient. Selection of a line will display the information relevant to that billing line, which can be checked and saved for billing. When the tariff code displays beneath the tariff code heading, it has been billed. Closing will display the billing line, which can be deleted or an additional item can be added. The total of the billing will display in the total field. Automatic billing is achieved through setups in the code tables. Automatic billing can be done, for example, from a patient type, such as an admission fee for an inpatient or a consultation fee for an outpatient. This can be set up by linking a tariff to the automatic billing tariff code field. The specialist in attendance for inpatients can also be flagged for automatic billing. Other automatic billing processes can be for a residency doctor, whereby the fee will be automatically charged per day when the accommodation is billed. Laboratory tests and radiology orders can be set up for automatic billing to be billed by the placer of the order, the filler of the order, at the time of posting the order or at the time of completing the order.